Good morning. My name is Sherry Pugh, and I'm the chair of the Minnesota Age-Friendly Council. We want to welcome you all this morning to our meeting. We're told that we're going to have a lot of extra guests from different sectors of the community and from government. So we're really pleased because we have a packed agenda today. We will, in our agenda, we're going to have two main focus areas, or three, I should say. One at the beginning, we're going to have the Reframing Institute do a presentation. The Reframing Institute had worked with the Minnesota Board on Aging back in 2017 when we were doing our 2030 plan and helped our organization tremendously in that work. But times have changed as we've seen the level of ageism really show an ugly head during this pandemic that we're incurring. And then we're going to have also state agencies make presentations on what they're doing in addressing the aging community so that we can integrate that into the work of this council. And finally, we have two organizations giving testimony today, Minnesota Gerontological Society and the Office of the Ombudsman for Long-Term Care. So it's a packed agenda. The questions, live questions, are reserved for members of the council, but we encourage others to enter questions in the chat, and if time permits, we'll pull those questions from the chat, and we will also answer any questions that we don't get to today and the ones that we do answer. They will be posted on the Age-Friendly website. Okay, so let's get going, and we'll start with the Reframing Institute. Mari.
Hi, good morning. 1 second, There we go. Good morning, everyone. Thank you so much for having me here. My name is Moira O'Neil. I'm the Vice President of Research Interpretation at the Frameworks Institute. And I would like to start off today with what I think is a really important reframe and an advance apology. So maybe some of you have seen this going around Twitter, and it's saying we are not working from home, we are at home during a crisis trying to work. And so with that reframe, I want to again offer some apologies. First, if you hear some blood-curdling screams, congratulations, you are witness of front row seats to my daughter's daily fight. We'll try to keep the voices down. We do have a lot of people trying to use the internet in my house right now, as I'm sure you guys are all having that same experience. So I want to apologize for any technological difficulties. And I am in my daughter's room, so we are a festive family, but that is the reason for the festive background. So what I'm going to do today is I'm going to talk in general about the reframing aging and ageism research that we did. But I'm going to take those findings and really ground them in the time that we're experiencing with COVID-19, and especially all of the discourse, the ageist discourse around older people and their role and their value in our society. At the end, I will point you to all of the resources that have that general research if you want to dig in any deeper. So who are we? I'll just do some really brief introductions. So we're a nonprofit. We're based in DC, although I'm here with you in the Midwest. I'm just right east of you in Madison, Wisconsin. And what we do is both nationally and internationally, we do original communications research so that the nonprofit and public sector can more effectively communicate about their issues. And the side of the institute that I work on is really tasked with making sure that any of those findings are usable and actionable for folks on the ground who are having to do the really difficult work of communicating for some kind of social change. So the work that we have done on aging was just a really exciting initiative. As you can see on the screen, a number of funders who are doing all kinds of work in the area of aging came together and thought about what was a common challenge that they were all facing, that they could come together and sort of move the needle forward on issues related to aging. And they decided together that communications was a big challenge. How do we change the conversation about the process of aging itself? How do we bring greater awareness to the issue of ageism? So from that project, we conducted a lot of research. I am not going to go into a lot of methods details, but if there's any questions, I am a methods geek nerd, and I'm happy to take those questions. So I'm going to start by just defining framing, and I'm going to look at a couple of other issue areas just so we can see why framing is so important. Then I'll get into some of the findings around aging and ageism. So when I say framing, it really is every single choice that you make in how you communicate about an issue, how you present information, the tone of voice you use, the values you invoke, the pronouns you use. So these choices can be very big or they can be very small. But why that's so important is because we know at Frameworks, and we know from the cognitive and social sciences, that these choices, no matter how big or small, are going to have a measurable impact on how people think about your issue, how they act on that issue, how they feel about that issue. So let me just show you some examples of this in some research projects. This one is done by some political scientists out of the University of Michigan. They conducted a study where they asked one group of participants, given the importance of free speech, would you favor allowing a hate group to hold a political rally? And then they asked another group of participants a slightly different frame, just a couple of different words, but given the risk of violence, would you support that same rally? When the frame is about free speech, about constitutional rights, you get 85% in favor. But when the frame is about violence, you get 40% in favor. So I mentioned all you methods, geeks, nerds, and I am one of you, you know that this is an incredible difference in response. And it really is just the matter of a couple of words. And this difference is not inconsequential, right? This is about people's political views, what they are willing to support happen in their communities. So how this issue is framed really makes a difference. So let me show you one more example. This is from some research we did on the issue of child mental health. I'm presenting this because I'm going to bring up some themes that I'm going to return to as I talk about how we should be thinking about framing aging and ageism, especially right now. So this is an experiment that we did to raise public understanding and support for policies that would better support children's mental health. What we found early on in our research is that people don't think children have mental health, or if they think or realize a child is experiencing some mental health issues, that they kind of think that they're very fatalistic, that that's just going to happen, it's genetically determined. So again, thinking about what are the kind of policies that we can implement to make sure that we're supporting all children's mental health, but especially those kids who might be needing some more support. So at this particular study, one group of participants gets the idea of future progress or social prosperity. So what they read is something that says, we need to support child mental health policies because children are the basis of our future. It sounds cliche, but it's actually quite powerful. They're about our future prosperity. They are, what our society will look like in the future. So we need to make sure that they have everything they need. And mental health is something that we need to be thinking about. Another group of people get the vulnerability frame. So we need to protect those vulnerable children. And that is why we need better policies that are evidence-based that will better support children's mental health. Another group of participants gets no message. So that's the thick black line you're seeing across your screens. And that's the control group. All groups are then asked questions that were designed to measure their support for evidence-based children's mental health policies. And here is what we found. The vulnerability frame, and I should have mentioned this earlier, this with the vulnerable child frame really was the frame that advocates were using to talk about children's mental health, was actually depressing support for evidence-based child mental health policies. And there's a number of reasons for that I think are important for us to talk about as we think about aging and ageism. First, it's the story that people tell themselves about why a child might be vulnerable. So if I were, if we were in different times and there were people, walking around the street and I could come up to them and interview them and I said, hey, this child is vulnerable. Tell me why they're vulnerable. I would hear a lot of things about their parents and their parents not doing their job, their parents being selfish, their parents not caring. And the problem with that story about vulnerability is it doesn't get people to the place where they can think about what is our collective responsibility, and importantly, what are the sort of collective solutions at the policy or systems level that we can put in place. So it may evoke sympathy for that child, but it's not getting people to the place of policy change. And really importantly, what a vulnerability frame does when you're talking about children or when you're talking about another part of the life course, is it really sets up an us versus them thinking. We are here to protect those vulnerable children. And even though it is from a compassionate or maybe empathetic stance, there still is a distance between the group you are helping and the group that is protecting. And the group that is protecting, there's no vision of how when we support everyone, we're all in a better place. And vulnerability doesn't get you there. So I don't need to belabor this point, but framing issues related to ageism and aging effectively matters now more than ever. I know that many of us, taken aback isn't even the word that we can describe when we hear some of the talk about how little we value older people's lives. So thinking about not only what is effective framing, but what we can do together is really, really important right now. So I'm going to talk about 4 ideas. And again, this is based on the research that we've done on how people think about ageism and tested strategies for how to better communicate about aging and ageism. But what are some of the learnings from that research that we can really put into practice right now as we are communicating in the time of this pandemic? So the first recommendation that we have is that it's really important that while we explain how big problems are, we make sure that people have a sense of how we might move forward, that there are solutions available, that the problem is not so big that we can't do something about it. So one of the things that we found in earlier stages of our research is people are extremely fatalistic, not only about the process of aging, so they think it is just has to be inevitably this period of decline, dependency, of loss, of sadness. But they also are very fatalistic about how we might restructure our society to better support a changing demographic. Now, an important thing that we found in our research is that I know nobody on this webinar, but often what we saw, advocates, activists, experts who were trying to bring greater awareness of this demographic change, they were using natural disaster metaphors. So you guys might have heard the silver tsunami, or we're falling off a demographic cliff. Those are ineffective because you can scare people, but you're not getting that efficacy balance quite right. So if it's crisis messaging, if it's just this is a dire situation, full stop, we are in a crisis, you do get a sense of fatalism and disengagement. if we are, we lean too much on the side of that we're efficacious, that we have solutions, people lack motivation. And I will say there is, typically this is not something that when I'm going around the country working with advocates, I usually try to help them get away from all urgency kinds of messages. I do think right now, there is a danger if we're too positive about our messages and the solutions that we might come off as tone deaf or not understanding the severity of the situation. So really calibrating that balance is quite important. And when you get that balance right, you get people's perceived agency, engagement, and action. So one of the things that's really important is as you are talking about how we better support the aging population in this time, what we do about ageism is that if you have a solution, even if it's just an idea of how we move forward, you should let people know. Don't leave them in that crisis state. Explain how that solution might work. So it's not enough to say we have this good idea, but once you have described the extent of a problem, giving people a really good sense of how if we implemented something or we changed something, how that would make things better for us all. And again, it's important that people, through your communications, that people understand that you recognize what an urgent situation we are in. So what does this look like in practice? And again, there's this very short, sort of small shifts in language choices can help you find that balance between urgency and efficacy. So you can say older people are at the center of the COVID crisis and are disproportionately impacted by the disease. Full stop. Of course, that is true, and that's a message that we want people to hear and know and act on. But because we're just talking about the crisis and not what we do, you might get people who will disengage. So one way that you can shift communications is to talk about, because older people are disproportionately impacted by the disease, states are planning community actions to stop exposures to the virus. So there we see that, you can point to a solution and you can talk about the very specific things that you are doing in Minnesota because of the disparate impact on older people of COVID-19. So first recommendation, balance urgency and efficacy. The second thing that we've been talking about with groups around the country who are trying to right now better advocate for older people is it sort of goes back to this idea that I talked about the danger of a vulnerability frame. So it's really important that we think about how we are positioning groups in our communications. And the reason this is so important is another thing that we found in earlier stages of research as we were out in the world talking to people across the country about how they think about aging, is the us versus them thinking was very strong. Even among, and I have this wonderful video to show you this, I can point you to it, even among people who you would look at and might identify as older, there was still a tendency to sort of distance themselves from older people. I am young, those are the older people over there. So we had people talking about how they're out of sight, out of mind. So recognizing that us versus them thinking is out there, waiting for your communications. So when we use terms like vulnerable older people, we are, again, automatically establishing a distance between some group that's going to do something and those groups over them. It can be it can be used in incredibly paternalistic ways, and in so doing can reify really harmful stereotypes that we have about older people. One of the things that we're also seeing is the sort of discourse around saviors, and this is absolutely true that especially healthcare workers are just doing so much to help us stay healthy. But it's often in this sort of heroic terms that those saviors are sacrificing for those victims over there. And I think also we can fall into a worthiness trap where we set up a group of people, older people, who may be experiencing some difficulties through no fault of their own. But what that does is when people start to look at other groups of people that may need more support, that may have different kinds of needs, that people start to evaluate the deservingness of those groups. And again, if we think that we want to, at this moment especially, to be supporting everyone, and especially all older people, no matter their situation, getting into that worthiness trap can be really harmful. So one of the things to do is to, instead of focusing on vulnerability, to first talk about our interconnection as strength, that we are all dependent on each other in some ways, that we all have a responsibility to people in our communities, in our society, in our country, whatever sort of collective that you want to invoke in your communications. To connect with common experiences. So, many of us, we are older, we have older people in our lives, we are worried about them. So to talk about that interconnection and how we are experiencing it. And to talk about everyone stepping up and doing the right thing, that we're not sacrificing or saving, but we're doing what's good for our community. And another strategy is to advance the principle of target universalism. So we wouldn't use the word targeted universalism, but the idea that you start with a common shared goal. We want everyone in our community to be healthy and to stay safe. And then you pivot to different groups, different needs. But in order to do that, we need to do X, Y, and Z for older people in our community. And then you can talk about other groups that also might have special needs. But it's not about those vulnerable groups. It's about us and the needs of groups of people who are among us. So here's, again, some examples of how you might do this in your communications. So this is talking about a common experience, right? So some of us who may contract the disease will have a few unpleasant days of aches and fever. But for the elderly neighbor down the street or grandparents, it's a different story. They're vulnerable to the disease, and we need to make sacrifices for them. One way to, again, advance this principle of targeted universalism is to say, hey, the virus is highly contagious. People could be spreading it without realizing. When we all stay at home today, we see fewer new cases tomorrow. By keeping our physical distance, we slow the spread. This protects people in our communities who are most at risk and the availability of life-saving healthcare we all depend on. So again, it's making about us, not about those people over there. The third recommendation that, again, comes from our research is that it's not enough to describe a problem, but it is really important to explain how it works. So one of the things that we found when we were out in the world, again, talking to people, is at that point, people, and I would argue that this is shifting, at that point, people, when we asked people, what do you think about ageism? We got answers that were a deer in headlights, where people didn't know what it meant. They didn't know that it existed. If they did know it existed, sometimes they downplayed the severity of the problem, especially when it was compared to things like racism or sexism or homophobia, that ageism can't be as bad as those things. So one of the strategies that emerged as very successful in the research is you can't just say something is ageist. You have to explain what ageism is and how it works. So this is really important as you all are out there talking about things that we can do to make sure ageist policies or practices are not put in place right now. And especially for those of you who might be interested or thinking about how different localities are dealing with standards of care. So it's not you need to stop being ageist, but this is what ageism is, and this is what we can do to address it. And so when you give people that more see how this works story, you get more support for solutions, more sense that we can get something done, and more engagement. And I would argue that this is really important right now because when we are talking about ageism, especially in the realm of healthcare decisions, it is really important that while we bring attention to potentially ageist practices, that we do not demonize the healthcare workers that may be having to make those very quick snap decisions without a lot of support. So explaining ageism, and I'll get to this, implicit bias is really helpful here, where we can talk about an ageist practice, but yet not demonize people in very, very hectic healthcare settings right now. So explaining why a problem exists, again, always connecting that to what actions and solutions do. So here's what this looks like in practice. So the before example that I am putting up is just stating that ageism in our healthcare system has always been a problem and it's becoming a crisis during this pandemic. And again, if you're saying that to a person who may not really understand what ageism is, or that it has always been a problem in the healthcare system, that message will be rejected, or people may say, wow, that's awful. We shouldn't do that to older people, but we're in a crisis. What am I going to do? So the after example is much more explanatory. So under stressful conditions, healthcare providers are likely to make snap decisions solely based on people's age. So there you're giving people a really quick understanding of how implicit bias might work. And so what that means is that we collectively needs to make sure our standards of care do not discriminate on the basis of age. So you have to take a one more beat in the after, right? So it's a longer example, but I'd argue that time for explanation is incredibly important right now, especially as we think about how ageism is operating in the healthcare system. So I think that now more than ever, how we framed will affect what's possible later. So one of the things that we're hearing a lot of stories about older people being disproportionately impacted by the virus. You're hearing a lot about, we have to put these measures in place so that we can protect them. But there's a lot of other stories about what are older people doing right now in the time of this crisis. So I have the great honor or pleasure to be working on a rapid research survey that some folks from the University of Oregon are doing. And they're focusing on parents of young children, 0 to 5, to see how they're coping during this time. And one of the things, and this is no surprise, but we're not hearing a lot about this. One of the things that we found in last week's surveys is obviously parents, caregivers do not have access to the childcare that they need right now. Those things are slowly starting to work up. And who is coming in and filling in those childcare needs, especially when parents have to work? It's older people, and often at risk to their lives. So putting out other kinds of narratives about how older people are also sacrificing to make sure that we can all get through this crisis together, I think is really important. So some other things to think about that again, from my vantage point, as I've been working with advocates and activists and experts and policymakers across the country, here's some things that, along with the issue of ageism, that I think that it's important that we sort of collectively shine a light on. The first thing is that, no matter where I am in the country working with folks about how to reframe their issues, the one thing that sort of comes through is that people want to inspire more faith in the public sector, in government, that we want more resources for direct services, for preventative services for older people. And so what that is going to require is that we, especially at this time, that we talk about government in ways that inspires faith, that talks about the actions that can be put in place and the solutions that the public sector is uniquely qualified to provide. So that's not to say that, don't critique the government, or if you are in a place where you're engaging in sort of partisan debate, obviously there's a place for that. But at the same time, really thinking about how we talk about government as the entity right now that can protect us better than any other entity. The other thing that is just very clear right now, and that is has been clear to many of us, but I think is receiving a lot more attention, is the racial disparities that are emerging from this pandemic. So it's not just that older people are disparately impacted, but older people of color, older people of low income are disparately impacted. But as we go out in the world and tell those stories, it's really important that we explain why that is happening. That leaves no space for people to blame the marginalized group itself. So maybe some of you heard the Surgeon General talk about racial disparities and saying something like, Black people and Latinos need to stop smoking. Now, he could tell another story. He could tell a story about the tobacco industry advertising in different and, quite frankly, predatory ways in communities of color. We could tell a story about environmental racism, people being exposed to different kinds of toxins that would make contracting COVID more serious. So it's important that we talk about the intersection of age and race, but that we give people good explanatory stories as to why we're seeing differences that we are seeing. The other issue that I think is really important that aging advocates sort of bring attention to is issues of economic justice. Again, one thing that's along with the importance of the public sector, of the importance of just a robust system of direct services for older people, is that income inequality, especially later in life, has just very detrimental effects. So we are in a position where we're experimenting with new kinds of policies just by necessity that sort of make sure that more people have the resources they need. And I think sort of talking about income inequality, how it affects older people, and how some of the policies that we might be seeing implemented right now should be further continued if we are to better support older people. So I'm going to stop there and I'll open it for questions. I just want to give a plug for a couple of things. So I don't know if many of you know, but the Frameworks Institute, we did the research, we've done the initial dissemination, and we're still doing the dissemination of that research. But now the body that is really housing the Reframing Aging Initiative is the Gerontological Society of America. They have a great website. It's reframingaging.org with all kinds of resources, including our research and toolkits that I think they've just done a wonderful job. And we're working in partnership with them, but I would really recommend that if any of you want to learn more to visit GSA. And feel free to sign up for Frameworks is every Friday, I think it comes out, where we have a COVID-19 newsletter where we talk about framing strategies that cut across issue areas, because we do work on things other than aging. But I think it can be really helpful as you are thinking about how you might reframe your communications. So I'm going to stop there. I'll stop sharing. We can open it up for any questions.
Oh, wait, here's Susan Vento.
So advice for framing in the midst of emotion, anger, and grief. I think that obviously those emotions are going to play a role, but I think that eliciting those emotions in others is not enough. So that if it's anger or grief, we want to make sure our communications gets people to a solution, or a sense of engagement, or how we might address the thing that we are so sad about, that we are so angry about. So it's really thinking about what the goals of our communications are. And again, from our perspective, from Framework's perspective, when we're trying to talk to people to advance some kind of change, that the emotion in itself is not enough. And just one way to be able to balance that is to make sure that people know you have ideas about how you might address the thing that is making you so angry, that is so hurtful. I talk to my mom every day, and as many of you might be experiencing or talking to people, is in tears every day, because it's just so blatantly obvious to her how little she matters when she turns on the news. But it's important, I to talk to her and everyone else who's feeling, well, what do we do about it? How do we change the conversation so that nobody can ever feel that they could say the things that they're saying about older people on the nightly news or, on Twitter.
Okay, I think I saw another question from, it disappeared.
Martin Fleischhacker.
Yeah, so it's important to define ageism. And one of the things that so I talked a lot in this presentation about the importance of explaining how implicit bias works, that, we make these snap decisions and our implicit biases are through the roof when it comes to older people. One of the other strategies that I didn't talk about in our time together is to give concrete examples of how ageism works. And one of the examples that we found to be really effective is to talk about how ageism works in the workplace and employment discrimination. So it's every sort of opportunity that you have to deepen people's understanding of ageism. I think it's a good opportunity to give them a little bit more than just an assertion that something is ageist.
While we're waiting, I have a question, because it seems that can you hear me?
Yes.
That there's kind of a tug of war between the boomers and the millennials. How do we create the common ground? We're the two greatest age groups in the country, but how do we show that we have similarities and we should be supporting each other?
You just say what you just said, but over and over and over again. We are interconnected. We rely on each other. What happens to one group of us happens to all of us. We have different needs, but when everybody is well, we are all well. And just to continually remind people of that interconnection, and then also to talk about the supports that each group gives. So boomers are doing a lot of childcare right now, for their families. At the same time, younger people need to be behaving in different ways because we know that the virus has a disparate impact. So just always showing that sacrifices are happening all around, and that we are interconnected through those sacrifices. And just don't be afraid of the power of repetition. Repeat it, repeat it, repeat it, repeat it, to overcome that really strong tendency for us versus them thinking. So yes, we have been working very closely with the Reframing Aging Initiative in Colorado, in Maine, in New Hampshire. We've worked in New York City. We've done some work in San Francisco and in Boston. I'm talking about the city initiatives. But yes, we've been working very closely with groups across the country, and all that information is available on the Reframing Aging website. So lots of places have adopted some of the reframing principles in order to move forward there. And obviously Minnesota was a trailblazer in incorporating the strategies.
Thank you.
Thank you for your patience, folks. So it looks like we still don't have Madam Chair back online. So we're going to go ahead and start with our presentations. I'm going to follow the order that was on the agenda, and we're going to start out with Minnesota Housing. Brian, if you wouldn't mind unmuting your line, and it's all yours.
Great. Thanks, Rena. Do you want me to bring up the PowerPoint?
I can drive the slides if you just give me, can you see my screen okay?
Yes, hang on. Yeah, great. That works for me.
Okay, and so if you just prompt me, I can move the slides along.
Awesome, and good morning, everybody. And I was, on Moira's presentation, I was thinking about how my dad, my 5-year-old's grandpa, was just about to pick him up for grandpa daycare today. So definitely think of my dad in my life as somebody of strength that's helping me out, work from home during all of this. So my name is Ryan Baumtrog. I'm the Assistant Commissioner for Policy at Minnesota Housing. And happy to spend, I think, about 5 to 7 minutes walking through Minnesota Housing's policies and opportunities around age-friendly programs. So I wanted to talk a little bit about Minnesota Housing. We're a state agency, but we're also a financial institution. And what that allows Minnesota Housing to do is operate and run several programs. So we have programs all the way from homelessness to home ownership, including rental housing. And so what I thought I'd do is just include, one example from our home ownership side that we often talk about as helping seniors age in place, and that's our rehabilitation loan program. So we're able, as a state agency, to do loans at 0% for up to $27,000. So make things really affordable for seniors that are on a fixed income that likely can't take on an additional monthly payment. We're able to give them housing opportunities and loans at a 0% interest rate on the home ownership side. On the rental side, Minnesota Housing just a couple years ago sought approval from the legislature to add an eligible use to one of the ways that Minnesota Housing works with developers all across the state to build housing through what are called housing infrastructure bonds. And so we were really excited that the legislature authorized both new resources and a new use that for the first time last year, we selected projects that are for seniors only, universal design. They haven't started construction yet, but it's the first time that Minnesota Housing's had a development program specifically geared towards the senior population. And then we also have a program that helps for older properties that were built in the 60s, 70s that need rehab, that aren't safe, that aren't accessible. We have our rental rehab program that can help provide really affordable financing. At the end of the day, that's what Minnesota Housing does, is we provide cheaper financing for rehabilitation and improvements than what the private owners and others can get across the state. So that's what makes Minnesota Housing unique. The other two things I wanted to mention is that as we look at Minnesota Housing's programs and who we serve across the range of all of our programs, we actually see that seniors are actually proportionally served pretty well across the state and federal programs when when we look at different age cohorts. And one example is the rental assistance program. If you're familiar with the federal Section 8 program, that's about 50% seniors. And so there are some mainstream programs. We don't have enough of them, but there are some mainstream programs that really help seniors stay in their home and also make sure that they aren't paying a disproportionate amount of their limited income on housing. And Rena, if you want to go to the next slide. Some of the, for the state agencies that we partner with, DHS is across the board for Minnesota Housing, typically the agency we work the most closely with. And the easiest way I thought about that was Minnesota Housing. We really finance what I like to call the sticks and bricks, the bricks and mortar, the buildings, the infrastructure. And then DHS, through its varied programs in home and community-based services, all the things that follow the individual, those are what help make housing accessible, what bring housing stability to individuals and seniors, that help keep them in their home. So we help finance the housing side of it, and with DHS brings some of the resources that help seniors age in place and make living a little bit easier for them. We also, at Minnesota Housing, have a number of partners to deliver our programs. We don't own or operate any housing at Minnesota Housing. We finance it. And so we rely on our partners in the communities to operate our programs, to build the housing, to operate the housing. And so I listed just a few of our partners that I think overlap, specifically as I think about the work with seniors around community action agencies, housing and redevelopment authorities that exist all across the state. And then some of our other nonprofit partners like Habitat for Humanity that has programs like A Brush with Kindness, or other things that really supplement and pick up where government programs and funding kind of drop off. And the next slide, Rena. I was thinking about the gaps and opportunities. So on the left-hand side, I have the opportunities. And, what I'd say is there's always been, it feels like since I started at the agency 5 years ago, a need and interest to develop senior-only housing. I think that's driven by both the demographics of the situation, but also the fact that there hadn't been really in a development resource that made housing affordable. We see a lot of senior housing being built, but it's just really not affordable. So there's real interest with our partners to develop and build some senior-only housing. Aging in place, we've done a couple reports and looked at things. Aging in place is really cost-effective, and it's also preferred. And so that really gears our programs, like I mentioned, the rehabilitation loan program, things that we can do to houses that were great at one time, didn't serve a purpose, but now need to be rehabbed, need to be improved, need to be made accessible to really help seniors age in place safely. I also say on the opportunity side, there's a lot of new ideas coming up. The housing, as we talked about, I appreciated the comments about reframing, because we've been working on reframing the housing situation. There's just a lot of new ideas about how to address housing and the lack of housing in Minnesota and across the nation. And one of those that I think fits with the senior population is accessory dwelling units. Adding on top of your garage, or adding on a smaller home in the back of your yard, things like that can really add, in housing terms, density, but then also offer a somewhat affordable housing opportunity for maybe a parent to move in, but not have to share the same space, if some people have a problem with that. And then the other opportunity that I see is sometimes it feels like there's more political will to address the needs of seniors. On the gaps, I won't go into all these details because I know we have a lot of presentations, but I think funding levels and affordability are things we see generally across housing. We're able to fund about 1 in 4 on the development side for applications that we get. And then for the rehabilitation loan program that I keep going back to around home ownership improvements, we did a research study with Wilder Foundation, and they found that the need for low-income households and seniors is $50 million per year, but we're currently funding it at $4 million a year. So just a huge gap on the funding level side. And the other thing that comes up a lot is funding characteristics. So at Minnesota Housing, we do a lot of loans. There's 0% loans, but they're still loans. There's still debt. And often as seniors get up there in age, we see more and more family members being a part of decision-making as it relates to what to do with assets. And so we've seen a number of situations where a senior household is approved for a loan, but then a family member comes in and doesn't want the senior household to take on more debt. And so we've done some thinking and are continuing to do some thinking about how best to serve the senior population in terms of loans or grants. And then Rena on the next slide. I wanted to highlight a report. The Governor Dayton back in 2018 launched a housing task force report that was a bipartisan housing commission made up of providers, renters, homeowners, government officials, from all across the state. And if you wanted a report to just kind of break down what is our housing situation, what are the goals, what are the strategies, I'd go to the Minnesota Housing Task Force.com. The report is pretty quick. I think it's about 70 pages, but the recommendations just give you a sense of what the state needs to work on in order to have a more healthy, balanced housing market. But there are a few things in there particular to seniors about increasing home stability and just the importance of that for our senior populations. I'd also say it's it was our first time trying to reframe the issue of housing. So you see a lot of language in there about economic prosperity and impacting us all and getting away from us and them, which is a really typical pitfall for affordable housing. On the right-hand side, I tried not to overwhelm, but John Patterson, who's also on the council but not able to join us today, he's done a fair amount of research about the key data points for seniors. And those are on the right-hand side. And these have really informed the agency's work as we've put together an agency strategic plan, as we develop new policies and procedures, that just most low-income seniors are homeowners, and that seniors are actually more at risk than other age cohorts of being cost burden. And what that means is paying more than 30, and in some cases, more than 50% of their income on rent. And when you're paying that much, or on a mortgage, and when you're paying that much of your income on rent or a mortgage, it can be pretty difficult to make other ends meet if you have healthcare costs and transportation costs and all of that. Rena can do the next slide. And then for the age-friendly metrics, the three that I think Minnesota Housing thinks about the most in our work is access to transportation. That's a big qualifier for our development programs. We give more points. We incentivize developments that are on fixed transit or have access to nearly 24/7 transportation options. We also have design standards. I mentioned universal design when it comes to senior-only housing, but we also have design standards as it relates to outdoor space and walkability and sidewalks. And so when we finance housing, we're thinking more than just the building. We're thinking about how does this fit into a community? What will it be like for individuals to live in that building? What are their access to amenities, sidewalks, walking paths, parks? All of that is a factor in our decision making. And then community and health services, especially as we think about senior housing, what are their access to services? Are there spots in the building that make access to healthcare easy? Are residents able to choose their own providers? All of that comes into play with our programs. On the next slide. I think that's it. So that's, I got my contact information. I know we wanted to keep these brief because we got a lot of presentations, so cover a lot fast, but can answer any questions at any time.
I believe Madam Chair joined via phone. So Madam Chair, I'm going to request Rajan to help facilitate the discussions.
Sure,
Just
thank
so, okay. Thank you.
Much
Rajan.
appreciated.
Yes, thank you so much, Assistant Commissioner, for that presentation. I think we'll move on to the next one while we kind of figure all of this out. And if we have some time, we'll come back to some questions. So appreciate that. Next on the agenda, we do have the Department of Health. Is anyone from the Department of Health available? I just wanted to check and see, Rena, if anyone wanted to offer comments. If not, we'll be moving on to the Department of Transportation.
Rajan, we do have Mary Manning from the Department of Health who's on the Google Meet, but if you wanted to just offer it up, please.
Yeah. Mary, if you'd like to talk to, speak to anything related to the Department of Health, we also could come back to you at the end if you'd like to have a little bit more time to think through things or. All right, so let's move on then to the Department of Transportation, and Victoria Nill, you'll be presenting if you're unmuted, and Rena will control the slides for you.
Yeah, thank you. Hopefully everybody can hear me and see my slides. Good morning, my name is Victoria Nill, and I'm at the Minnesota Department of Transportation. And when you asked about what are we doing about age-friendly Minnesota, I of course took this opportunity to be selfish and highlight my office, the Office of Transit and Active Transportation. Next slide, please. So active transportation, that's kind of a unique one. Transit's self-explanatory, but you know what it is? It's walking, biking, scootering, any skateboarding, any kind of active transportation, you know, anything really other than the car. And so we do have our mission statement there that you can read, but our vision, this is kind of cute, I like to say it, connecting Minnesota one ride, stride, and pedal at a time. Next slide, please. So obviously as people get older, driving a car doesn't have the appeal that maybe it had when it was younger. I know that my parents don't like to drive in any way. My father's blind, so he can't, but my mom is definitely not loving driving anymore. So transit, walking, and biking are kind of her primary ways to get around. And it's awesome to have a daughter like me who works in that statewide. So on to the next slide, or this slide here, the state agencies that we work with. Well, the legislature in 2010 created this group called MCOTA, the Minnesota Council on Transportation Access. And the goal here was to make recommendations to improve the coordination of transportation between all the agencies. And you can see all the agencies do have a bit of transportation in them. It's not in their title like it is for MnDOT, but they do have some responsibility for transportation. So this group gets us all together and we talk about how we can coordinate that. You know, an example is if you have an assisted living and you have a hospital, there are several trips between those two destinations and origins. And there's like 7 different types of shuttle that go there. You know, the veterans are different than the public transit, which is different than DHS. So how can we coordinate that and do a better system? A big thing that what this group is working on right now is the volunteer driver, trying to get volunteer drivers together, trying to help them with state and federal statute to make it easier to be a volunteer and to provide the support to volunteer drivers. Next slide, please. All right, gaps and opportunities. There's a lot of stuff here. I won't read all of them to you, but I'll just highlight a couple that I think are pretty darn cool. So the first one is sustainable transportation system. Now, if you think about that, walking, biking, and transit, that is the best way for transportation to leave the smallest carbon footprint, to eliminate the greenhouse gases, and just healthier all around. It's more sustainable. So I just love being able to talk about walking, biking, transit, and sustainable transportation. The other thing here is increased access to mobility hubs. Totally going to steal the thunder from Met Council here, but I mean, they have the saying destination anywhere on their trains, right? These mobility hubs, same thing, destination anywhere. We can get people to those mobility hubs and seniors will be able to go anywhere and not feel secluded. Biggest challenges right now we see, tying into the framework discussion earlier, is transit ridership is going to have a huge impact on with COVID. Now, as COVID works its way through, we will definitely see that the cars will come back. It'll be, the diagram will be a V. We had a huge decline and we're going to have a sharp incline. Transit's not going to be the same. Transit's going to have like a more of a U shape with a pretty flat bottom, with kind of that stigma of not wanting to ride on transit right now. So that's going to be a challenge to get people back feeling comfortable again on transit. And then investment opportunities, you can see that we're just trying to help all the smaller transit agencies to do statewide initiatives. So we can pull everybody together and pool our resources and really look at this as a statewide thing that we can help solve. Next slide, please. All right, so a report that I'd like to highlight. All right, all of this bragging, I love this. These are some of the things that MnDOT is doing, particularly Office of Transit and Active Transportation. We do a lot of statewide, region-wide walking and biking plans, filling in those gaps where you don't want to have to walk out into the traffic. So those are some of the things we're working on. Something you'll see soon is the safety education campaign. Share the Road. Have you guys heard that? It's kind of aged itself out, and Share the Road actually brings some negative energy to it. So we're coming up with a new safety education campaign to be able to have all types of modes coexist in the roadway. And my last slide, I believe, the next one. All right, how MnDOT ties into all the goals with this group. Obviously transportation, since T is the transportation in our name, but also the outdoor spaces. MnDOT is the biggest owner of property in the state of Minnesota. So let's make sure that those spaces that we own are safe and visible to everybody at all age. And then just the respect and inclusion, that was more an inward thing. MnDOT has a lot of diversity and inclusion teams that we work on that pretty regularly. And that is it for my slides. Thank you for letting me present. And any questions about walking, biking, transit, give me a call, let me know. I love talking about this stuff, and I love to work with you. So thank you for that.
Thank you, Director Nill. And Rena, I just want to confirm that we can put these slides on the Age Friendly Minnesota website so people can go back and look at the data and information. And Rena is saying yes. So next up, we have a council member from the Age Friendly Minnesota Council, and also a representative from the Minnesota Department of Employment and Economic Development, Lorrie Janatopoulos. Council member Janatopoulos, you available?
Yep. Can you hear me?
We can. Thank you.
Great. Yep. Thanks, Rajan. Great. I'm excited to be here this morning and present on the Minnesota Department of Employment and Economic Development, DEED. I am the Career Force Director at DEED. DEED has two kind of primary divisions. One is the Workforce Development Division, and the other is the Economic Development Division. As the Career Force Director, I work within the Workforce Development Division, and I oversee 50 Career Force locations across the state of Minnesota. We have about 150 employees in those locations as job service staff, as well as veteran service staff. And I also oversee the state's labor exchange, minnesotaworks.net, and our resource platform, careerforcemin.com. And so if you go to the next slide, Rena. So with regard to programs and policies that we have, we've got the Senior Community Services Employment Program, SCSEP. SCSEP helps eligible workers who are 55 and older update their skills for employment. It's funded by the Department of Labor. It's a community service and work-based training program for older Americans. Enrolled participants receive training including internship, classroom, job search training to develop skills and transition to unsubsidized employment. It's an eligibility-based program, so it's for older adults 55 and over who are unemployed and not job ready, and who are at 125% or below of the federal poverty guidelines. We also have State Services for the Blind Senior Services Unit that provides direct in-home vision rehabilitation services for qualifying adults 55 and older. Eligibility includes a vision loss that despite correction does not allow participants to read regular print. Participants aren't working and aren't planning on working. So this is different than the majority of DEED programs that really work on workforce development. We also then have our career force locations that I mentioned statewide. We have a job search for mature workers workshop. That's an accelerated version of creative job search focusing on managing difficult job search barriers such as being overqualified, worried about age discrimination. These workshops help coach participants on communicating their strengths and how their experience makes them a good fit for jobs and companies. And careerforcemin.com is a platform that has a lot of resources, including resources for the over 50 workforce. With regard to policies, a big addition this year to the One Minnesota Workforce Innovation and Opportunity Act state plan was adding age to the goal of building an inclusive employer-led talent pipeline. The One Minnesota WIOA state plan is a plan containing visions and strategies for workforce development that includes DEED, other Minnesota state departments, the Governor's Workforce Development Board, local and regional workforce development boards, higher education, community and business partners, and they are strategies and goals that we are prioritizing over the next 3 years. And that prior to this year, race, disability, and gender were included as measures of inclusivity for that goal. And this year, age was added to that list. We also have been watching legislation about increasing access to telemedicine throughout the state and expanding broadband access to unserved and underserved parts of the state, although not exclusive to older adults. Both of these initiatives would, benefit the aging and older population. If you want to go to the next slide, Rena. So with regard to our major partners, I've already talked a little bit about the Governor's Workforce Development Board, the GWDB. Every state under federal law is required to have a state workforce development board. The majority of our members are representatives from business, as they are across the nation. We have 23 businesses represented. We have 14 members from higher education or government, 6 from labor unions, 2 from community-based organizations, an additional 17 from non-voting areas have been added by state statute. The GWDB, although staffed by DEED, is advised directly to the governor. We also have service delivery partners for SCSEP. Last program year, there were 11 subgrantees across the state. Some were local units of government, like Anoka County, other counties, City of Duluth. Some were private nonprofits, like Community Action Agencies, Arrowhead Economic Opportunity Agency, Minnesota Valley Action Council. Minnesota Chippewa Tribe is also a subgrantee. And each subgrantee has host agencies, and the host agencies work directly with the participants. They must be a government or nonprofit, nonpartisan organization. State Services for the Blind Senior Services Unit has an Aging Eyes initiative that works with a variety of senior serving community partners. Some examples of those current partners are Living at Home Network programs, Faith Community Nurse Network of the Greater Twin Cities, Centers for Independent Living, and DHS's Deaf and Hard of Hearing services. At Career Force locations, we're the workforce centers, was the older name, and we are the one-stop locations. And so as such, partnership is part of what we need to do. And so we've got these partners included in addition to DEED staff, including job service staff, vet staff, vocational rehabilitation service staff. We also work with adult basic education, Department of Human Services for participants on the Minnesota Family Investment Program. I already mentioned jobs for veterans, staff, local workforce development boards and their staff, and other employment and training providers such as community action agencies and other nonprofits. If you want to advance the slide, that'd be great. Great, thanks. And so with regard to gaps, it seems to me, just in looking, it was fun actually doing this because, it did kind of coalesce the information for me in some respects. And some of the gaps that I could see are that although we have workforce programs that serve regardless of age, there's not really a comprehensive strategy for older adults. There are capacity issues for SSB, SSU. For example, I think that by modest estimates, there are 25,000 Minnesota seniors who could be eligible and benefit. But with available resources, we just served over 4,200 consumers last year. There's always with workforce development, the adjacent workforce issues such as transportation and housing, and also with seniors, I think technology is an important issue that we have to keep in mind. The differing understandings of what the aging population is, it seems to me that without a common definition determined, in somewhat like common characteristics, it is difficult to then use data to determine impact across domains. And so perhaps a little bit more focus on what that means and what impact we're really having. I really see opportunities for coordinating efforts of DEED as well as those of other workforce partners. I think expanding, if possible, of course, this would require funding, to meet SSB, SSU services to meet current and growing demand, to really utilize data to better target services for older career seekers. How can we really assess what their needs are? Perhaps dual enroll them and make sure we're working with employers who want to hire older workers, and also then leverage our platform, careerforcemin.com, and other platforms to enhance digital learning opportunities for career seekers, and making sure employers who also use that platform have resources that they can use in order to hire older workers and others who are underrepresented in the workforce. Next slide.
Just a quick check-in that you've got about 30 seconds.
Perfect. Okay, so thanks, Rajan. All right, so labor market information, I think this is the most interesting, so I'll concentrate on this, and then people can see the second to last slide in a bit. But in 2019 then, prior to COVID, the employment to population ratio, 65 plus, 23.7%. I think that seems pretty high. And I know that we really were reaching out to get as many workers into the workforce as we could, given the need. Unemployment rate was 2.2%. As you can see there, the number of older workers that over 65, the percentage of jobs they held and what those jobs looked like. Analyzing COVID-19 impact on the workforce, 179,027 people over 65 applied for unemployment insurance benefits. Labor force participation rates have declined significantly among the older population. Next slide. And if you could go back just one, I just want to say one thing about the career force numbers. So also we serve a lot of customers over the age of 40, 52% in career force locations, and still 31% of those are over the age of 65. And so I think that's pretty significant and an opportunity, as I mentioned before. Last slide. So the things that, with employment, the things that we really focus on would be civic participation and employment, but also then what comes along with that, social participation and respect and social inclusion. So that's it. That's my presentation. Thanks for the time.
Thanks, Councilmember. Next up, we have from the Minnesota Department of Commerce, Martin Fleischhacker. Marty is also a council member on the Age Friendly Minnesota Council. So thank you very much, Marty, for your time. And if people do have questions, please go ahead and put them in the chat. I've seen some of our state agency partners doing some answers there, which I think is helpful. So take it away, Mark.
Thank you, Rajan, and other council members and participants today. And it's always hard to follow Lorrie. I've had to do it a few times this year, so I'll do my best here. It's hard to shrink these programs down to about a minute and a half each, but here goes. The Weatherization Assistance Program, the U.S. Department of Energy funds Minnesota's Weatherization Assistance Program that reduces energy costs for low-income households by increasing the energy efficiency of their homes while ensuring their health and safety. The weatherization improvements and upgrades save participants an average of $283 or more every year. Professionally trained weatherization crews complete energy assessments using advanced diagnostic equipment while also ensuring the occupant's safety by checking indoor air quality, combustion safety, carbon monoxide, and identifying any mold infestations, which are all indications of energy waste. Trained crews install the identified energy efficient and health and safety measures to make sure the home is safe for occupants. This program is essential. It's estimated that low-income households spend about 16.5% of their total income versus 3.5% for other households. Often they must cut back on healthcare, medicine, and groceries to pay their energy bills. The program helps to alleviate this heavy burden through home improvements such as insulation, sealing air leaks, or upgrades to heating, ventilation, or air conditioning systems, lighting, and appliances. Many of these health or safety items. In fiscal year 2019, more than 2,000 households statewide received services through the Weatherization Assistance Program, and about 65% were in Greater Minnesota. Our Energy Assistance Program, or what we call the Energy Equity Program, is a federally funded health and safety program that helps income qualified households maintain safe, affordable, and continuous home energy through bill payment and emergency assistance, including repair and replacement of mal or non-functioning heating systems. In 2019, our energy program served over 49,000 households with members over 60 years old. The Energy Assistance Program provided a senior-specific emergency benefit, paying any past due or current utility bills. The program ensures seniors maintain adequate heat throughout the winter and reduces the burden of cooling costs in the summer. An average utility subsidy of nearly $560 per participant is provided, and over $35.8 million in benefits are provided overall. Excuse me. Our telecommunications, we have several programs. So Commerce offers telecommunication programs to help low-income Minnesota residents. Minnesota's State Telephone Assistance Plan works in conjunction with the federal Lifeline program to provide telecommunication discounts to income-eligible residents. Lifeline, which is a federal plan, and Minnesota's Telephone Assistance Plan provide eligible subscribers with a monthly credit on the basic service portion of their landline telephone, wireless, or internet services bill. An additional benefit is available for residents living on tribal lands. Also, a program called Link Up provides a discount for first-time connection charges, on tribal lands. Link Up also provides for deferred payment connection charges without interest. Our Telephone Access Minnesota program is really two programs. The first is the Telephone Equipment Distribution Program, and that provides a variety of adaptive phone devices to people who have difficulty using the phone. People who are deaf, deafblind, hard of hearing, or who have a speech or physical disability often find these devices make using the phone easier. Devices are loaned at no cost to those who qualify for as long as they're needed. Minnesota has a relay program that we administer, and that's specially trained communications assistants facilitate telephone conversation between a person with hearing or speech disability and other individuals. Calls can be made to anywhere in the world, 24 hours a day, 365 days a year. All calls are confidential. Minnesota Relay is administered by the Minnesota Department of Commerce and is funded by a monthly surcharge on each wired, wireless line and a fee for prepaid wireless retail transactions. And then my program is the Senior Safe Financial Act. And basically what it is I get referrals every month from broker dealers and investment advisors, and they tell us, but I get calls really from around the country and all different people. And what they do is they inform us of people who are being financially exploited or where fraud is being committed. Next slide, please. For our weatherization program, the Department of Energy awards the grants. Minnesota contracts with local agencies, including community action agencies, nonprofits, and local governments who use in-house employees and private contractors to deliver services to the program's low-income families. In 2017, utilities and states supplemented the Department of Energy's funding by providing $3 for every dollar invested by the Department of Energy. For our energy assistance program, the U.S. Department of Human Services funds the program. They partner with us. The funds are distributed through 21 community action agencies, 5 tribal governments, 2 counties, and Lutheran Social Services provides the benefits in Crow Wing County. Next slide, please. Continuing with the program.
A minute left. Just want to put that.
Okay, I'll start flying. So our telephone equipment distribution program is funded through our department and administered through the Department of Human Services. Our Senior Safe, I deal with all kinds of state government agencies. I work with the BBB. They're fantastic to work with, and so is ARP, Jay over at ARP, and others. So next slide, please. Gaps or opportunities. Our weatherization program is very specific in what we can install. It would be helpful for us if we could work with the Board on Aging because they have additional funds and we could partner up and we could install more things using the same contractors to help people. That's just to summarize it quickly. The Energy Assistance Program provides an estimated 22% of potentially eligible senior households increase and improve application assistance. Resources and outreach could help additional households. Telecommunications, again, they need more resources. And for my program, Senior Safe, we're going to add banks and the legislature added banks and other financial institutions, credit unions to my program. So next slide, please. For the weatherization program, we have economic demographic data on the users, same with the energy assistance program and the telecommunications program, the same thing, data on all users, and I have all investigative data on the programs that I administer. And looking at the programs overall, our weatherization and energy assistance program go with the housing, the telecommunications go to communication, information, and social participation. And what I do touches on all of these. So thank you. Sorry, I ran a little over.
Thank you very much. This is a bit like speed dating or speed networking. So we appreciate everyone getting through these. I think it will give us a good breadth of information about the state agencies, but we'll definitely have to come back and do some more follow-up. So thank you so much, Council Member. So next on our agenda is the Minnesota Board on Aging, and the presentation will be done by Chair Susan Mezengga, the board chair. Chair Mezengga?
Good morning. Can you hear me?
We can, thank you.
All right. So my name is Susan Mezengga. The Board on Aging is an administrative board that is housed in the Department of Human Services. When we have a full board, we have 25 members that represent all the districts in Minnesota, and these are governor appointed members. I'd just like to give a shout out to the Department of Human Services. In their long-term care services, they have received several national recognition awards in the past several years. And I think we are viewed by many of the other states as a leader in the types of services that we provide to older Minnesotans. Next slide, please. So the mission of the Minnesota Board on Aging is to ensure that older Minnesotans and their families are effectively served by state and local policies and programs. Our tagline is in order to age well and to live well. We have 3 roles that I think delineate what we're all about. Our first role is sort of an administrative role. We work with our 7 area agency on aging to distribute the Older American Act funds to their communities. We discovered early on that one size does not fit all. We're all governmental agencies, and we know that we are guided by certain guidelines that we have to follow. But given that, we encourage our agencies, local area agencies, to create programs that are going to be specific to the unique needs of their communities. And I think that's working well. As an advisor, we're just out there to promote public education, really to anybody who's listening. And we think that's more important than ever in this day and age with the needs of our older Minnesotans just coming front and center. And finally, our third role is, the major role is one of advocate. And I think we are embracing that, this particular board, especially with a great deal of enthusiasm. A perfect example of that is just a week or 10 days ago, several of our board members became aware of some legislation that was being forwarded kind of at the last hour that was detrimental to the rights of residents in nursing homes. And they quickly mobilized and got information out on who to contact, what to say, how to communicate to those decision makers that this was not something that we would endorse in any sort of way. And I think going forward, as we network more and as everybody is talking, we interact with all these other agencies, that advocacy role is going to be one that we really embrace greatly. The 2 direct service programs that we have through the Board on Aging are the Senior Linkage Line. That's our information and referral service. And then the other one is the Office of the Ombudsman for Long-Term Care. Certainly that office is out there right now, fighting the good fight for all of us. The services that are available to older Minnesotans follow a continuum, going from older Americans that just need a few little assists to remain in their homes, all the way to those individuals who might need 24/7 skilled nursing care. These services are part of different programs that have different eligibility criteria, but they're all guided by personal support, person-centered planning, and really that self-determination of allowing people to choose what they need to make their lives safe. We actually, Board of Aging, age-friendly, we actually partner with almost every single agency that is up on the board. We partner with corrections. I didn't know this until recently, but older Americans are the largest demographic in our correction system. We certainly we partner with Minnesota Home Finance. We homelessness, MnDOT volunteer driver program, and Council on Disability. So we're partners with all of them. Next one. Gaps and opportunities. Well, there's always gaps. The Board of Aging has challenged ourselves, especially this last year and moving forward, to look through everything we do through the lens of diversity, equity, and inclusion. we acknowledge that we have some ways to go on this, and we especially want to make our efforts to include individuals from diverse communities in our decision making, and to make sure that our funding opportunities are there for them. Next slide. Any of these reports are available and of importance to a number of other community partners that are working to support any particular group of older Minnesotan, Minnesota 2030 report, State Plan on Aging, Healthcare Choices. Next slide. And finally, Board of Aging, age friendly. What we do touches almost every single other, all of the areas of the age friendly Minnesota, with housing, outdoor spaces, social isolation, all of the programs that we do. We work hard to collaborate and interconnect with almost all the other agencies that we've talked about, and then most of the nonprofits in the state. Thank you.
Thank you, Chair Mezengga. Next up, we have Susan Vento, who is a council member on the Age Friendly Minnesota Council and also a council member on the Metropolitan Council. So Council Member Vento.
Thank you, Regine. I want to begin by noting that Freya Thaman, a member of the Met Council staff, is making me look way better and way smarter today than I deserve. She provided enormous efforts to put together the slides and to provide me with background information. I was appointed to the council a year ago along with 15 other council members, and I want to just begin by telling you a little bit about the council. Our charge is to help with planning in the 7-county metro area, which includes 188 municipalities in the 7-county metro area, impacting 3.1 million residents. And the forecast for growth, in case you're wondering, between now and the year 2040 is an additional 800,000. Of course, what we're experiencing now with the pandemic will likely impact that growth and much of the planning we've been doing. Our council is governed by a 17-member council. Our chair and at-large member is Charles Zelli, who came to the council with extraordinary background, both as a business person as well as an active member of the community and former commissioner of transportation. In addition, there are 16 of us who represent the 16 districts that comprise the Metropolitan Council. In our planning, we plan for future growth of the region, and we focus on the future development of our regional parks and trails. We currently have 50 regional parks and 400 miles of trails. We are responsible for owning and operating the Metro Transit system. Additionally, in the area of transportation, we are involved, we run the Metro Mobility Program and and we work on affordable housing through our Metro HRA, which is the largest HRA in Minnesota. We provide housing, and we also work on the development of housing policies and planning. And then finally, we are nationally acclaimed for the work that our wastewater treatment programs in sites throughout the metro area provide. We are charged with keeping our lakes and rivers as clean as possible, and that is quite a hefty responsibility. We are able to do it at a 40% lower rate than peer regions from around the country, and we're regularly recognized for excellence in the area of wastewater treatment. I mentioned the growth. I also want to note that 1 in 5 residents currently in the metro area are 65. That's compared to 1 in 9 in the year 2010, just 10 years ago. And 4/5 of the household growth between 2010 and 2040 will be among older households. In the next slide, in this slide, the current policies and programs slide, you'll see a brief recap of those various areas that I've mentioned. I want to note that as it relates to the regional parks and trails, older Minnesotans here in the metro area are among the most active users of our parks and trails. And we work with the park agencies and the users of the parks on a regular basis to improve, to expand, and to provide real quality opportunities for folks. With our transit system, I want to note that currently during this pandemic, our transit system is broadening its assistance to older residents as it relates to grocery delivery and helping them stay safe at home. Next slide, please. And Freya, be sure to pipe in if I'm missing anything here and need to better clarify some of this. As it relates to housing, 7,200 families in the metro area are assisted with low and moderate, or excuse me, are impacted with low.
It seems that perhaps we lost Susan Vento. Freya, are you on the call? Could you continue the presentation for the Met Council, or would you like us to move on?
Yes, good morning. I'm here. Can you hear me?
Yes, thank you.
Yes. I'll just continue on, and then hopefully Councilmember Vento can come back into the meeting. I think she was just speaking about the council and its work, and had talked a little bit about the HRA program and the number of seniors that are served through that. The council also has other broader policy plans where the council's work intersects with seniors and age-friendly initiatives, and our housing plan does have housing policies that are very specifically related to that. It looks like Councilmember Vento is back, and so I can shift that over. I saw in the chat that she's there, but should I try
keep going until she jumps in, if you could. We'll keep the schedule going. So.
Okay. So the council has many different areas of work, as Councilmember Vento had mentioned, and kind of key to the council's work is the idea of collaboration. So the council collaborates with many different folks, knowing that collaboration and getting the best thinkers together results in the best decisions and results. So it collaborates with many different people. As we heard MnDOT say, there's relationships with the council on that, but with many different folks. Collaboration is very key to the Met Council's work. Next slide, please. A lot of the work that the council does have kind of a resource-based approach. And so some of the opportunities that could be ahead are, additional data and analysis. Councilmember Vento had mentioned that the council's work is specific to the 7-county region, and there's a lot of wonderful data and research that the Met Council research staff says. So there's potential for additional data and analysis, research resources, assessment, for example, of senior housing in the region. I myself work in local planning assistance, and so one thing that would be another opportunity is providing technical assistance to communities and additional collaboration. Here's just a few examples. There's we had age-friendly Maple Grove as, for example, a resource for communities, so that as they're working on their comp plan, they would have that as a resource. And the thought was to connect communities to other communities who are doing great work. So some of the ideas. Next slide. This just highlights some of the data and research that was mentioned. There's a lot of information as shown on this slide, from big picture regional trends to more specific information that's related to building permits that are annual pieces of information that are gathered, and that information can look into housing type and has started to look in, for example, to senior housing types that are being built. We've got housing production surveys and a lot of different interactive type maps and information like travel behavior inventory information, where that information can be analyzed to see how older adults are traveling and get a better assessment of that. So these are just some outlines of some of the data that is available. Next slide.
Freya, if I could do the wrap up here.
Oh, sure, please.
Great, thanks. I like Chair Pugh, I had some power outage here in South Maplewood last night. I'm not sure if it's that or my continuing tech challenges, but our age-friendly metrics really does connect with, as a council, we connect with the outdoor, particularly through our parks and trails, certainly transportation through Met Transit, Metrolink, and also Metro Mobility, and then of course housing, current and future growth. And as someone who just recently celebrated her 66th birthday in the midst of this pandemic, it seems kind of weird to use the word celebration. I should perhaps say observation. I just want to say what I've maybe said before, but I really appreciate the work of this council and the focus by our governor. And I really appreciate both the framing presentation earlier today, as well as each of these agency presentations. It's really helping me as a newcomer to much of this conversation to better understand and better advocate for our goals. Thank you.
Thank you, Councilmember Vento, and thank you as well to Freya for jumping in. We're now moving to the Minnesota Department of Veterans Affairs, and that state agency is represented by Council Member Simone Hogan, who also serves on the Age-Friendly Council as one of the triumvirate from the Department of Veterans Affairs. Councilmember Hogan.
Good morning, everyone. Hopefully you can hear me. Happy to be here. It feels as though it's been a very long time since participating in our first kickoff meeting. So I think it's been approximately 3 months, but living in the world of COVID-19, it's certainly affected our facility and long-term care facilities across the state. It's nice to step away and do something a little bit different for a couple of hours. Can you move on to the next slide, please? Just briefly, so I'm representing our Minnesota Department of Veterans Affairs Healthcare Division. We operate the 5 state veterans homes that are throughout the state. Currently, we serve approximately 800 veterans in those homes. We did go through a process this past year of designing 3 new veterans homes. Those are waiting approval and funding through the federal VA grant program. Those will be a great addition to our state if and when those are funded. I feel very confident that the way in which we approach the design of those homes really took into consideration what our current and future veterans, as they move into that level of care, may want and desire. But even more importantly, our homes really are a hub for community engagement for veterans that reside in that area. And so ensuring that they provide a space not only for someone that's living, but also for a community to be able to engage and support veterans-related issues. I think our 5 current homes really are a good place for doing that at this time. And so this is something that we took into consideration with that new design. Certainly, I think our current impacts of the pandemic have had some great impacts on that ability in our homes and for our residents. And I'll talk a little bit more about that in future slides. I also want to highlight, the Minnesota Department of Veterans Affairs, we have 2 divisions, and Programs and Services is our 2nd division. And they also provide a number of services and programs for veterans that I would certainly categorize as also being age-friendly. But one to highlight is their core program, which is a contract relationship that they have with Lutheran Social Services to ensure that veterans and their families have access to mental health and caregiver support. And what we have identified just recently in the last several months is that caregiver support is becoming more and more critical as their access to healthcare services is limited, making sure that we're creative in ways in which we reach older adults that still may be living in their home, want to stay in their home, but ensuring they have the support and resources to be able to do that. And I anticipate that the pandemic is really going to force us to shift and look at that differently than maybe we have done in the past. Next slide. Agencies and government partners, really our primary one that I identify is the Federal Veterans Administration. We have a great partnership with the healthcare side of that federal agency as it relates to our regulatory oversight, caregiver support, suicide prevention. We're also working closely with DHS, the Department of Health, and then uniquely too, we have a relationship with the Commander's Task Force, which is a task force that represents all of the veteran service organizations. Next slide. So from a gaps and opportunities standpoint, it's somewhat kind of stripped down, but I think one of the big pieces that I always hear is veterans education regarding benefits, services, and supports is very complex and unique, and knowledge of that is really challenging. And so making sure that we have that frequent and accurate communication going out and a strategy for that is critical. I'm a clinical social worker by background, and I think also from a opportunity standpoint, social isolation is really critical right now, I think, for our older adults. And the long-term effects of that, have yet to be really known. And I think that that's really an opportunity as we think about this philosophy too. Next slide. So I highlighted some report and data that we collect. Certainly from an activity standpoint, we believe that we have a very well-rounded, robust activity program. And then also that Lutheran Social Services contract, we have data as it relates to that and how that access is delivered and received to veterans across the state. From a civic participation and employment, one of our strengths in our homes is our volunteer program. And I don't gather ages of our volunteers, but, I could say that a majority of them would fall in that older adult category. And those are critical individuals to our operations. Our veterans love their presence, and certainly the thousands of hours they provide to our homes is really critical in how we do our job. Next slide, please. I identified that we're touching, all areas of the matrix. And so there was only a couple of triangles that I could note, but I think these are all the areas that the veterans homes and our agency are really touching and working on this issue. And I think that kind of wraps up our presentation, unless there's anything else that I can note.
Thank you so much, Councilmember Hogan. We have your email here, and if anyone has any comments or questions, they can put them in the chat as well. I think we'll move on to our next state agency. We're down to our last couple, and so this again has been quite a speed dating round for us. I'd like to introduce the Department of Human Services, and speaking on behalf of them, Assistant Commissioner Dan Pollock, who also is a council member on the Age Friendly Council. So Councilmember Pollock.
Thanks, Rajan. Can you guys hear me okay?
We can, thank you.
Okay, good. I'll be brief and appreciate everybody's tolerance of me kind of being late to this. We are doing so much on the COVID response, and it really does interfere with the need for getting good work done on this. So I'm so appreciative of Rajan and Rena and everybody on the council spending time on these other important priorities that need to continue to get our attention even during the pandemic. Let's go to the next slide. So Age Friendly prior to COVID was already front and center at DHS. It's actually part of our strategic planning work and part of our response to the governor's request for One Minnesota direction and strategic application of those principles. And so this is just a graphic that shows how DHS is applying its strategic planning across all services and all sectors, trying to work with others, meet everybody's basic needs regardless of their age, regardless of where they live, making sure everybody lives with dignity and achieves their highest potential. Commissioner Harpstead actually just in a couple weeks before COVID hit was in the process of doing a major overhaul of our strategic planning to really inform the 2021 session and kind of get us really positioned well for the next 2 years of the Waltz Flanagan administration. Next slide. So within that context, obviously the Continuing Care for Older Adults Administration, the one that I represent, is very focused on people over 65 in terms of all of our work. I think most of you have seen these slides before when I've presented and talked about our work. It's a lot of spending, a lot of services. I would love to see ideas from the council and ways that we can use this money in more age-friendly approaches. I'd love us to, do a better job of prioritizing equity in underserved communities and tribal and rural communities, and really getting the number of abuse complaints down and the number of healthy communities up, and really keeping Minnesota as an age-friendly state front and center for all of our work across all services, all spending, all programs. Next slide. So obviously we work with all of you in a lot of different ways. We work with Commerce on insurance products and Medicare regulation. We work with Minnesota Housing. I've actually been working with Minnesota Housing more in the last 3 months than probably in the last 12 years because Kathy Tenbrook, who leads the Interagency Council for Homelessness, is my co-chair of the at-risk populations working group for COVID-19. And I'll talk more about this in a second, but she and I actually present to the governor and lieutenant governor every day on how COVID is impacting both older adults and people who are at greatest risk of COVID. So that partnership has been very, very successful and is a very important one here. Oh, I skipped MDH, obviously. MDH and us work closely together both on COVID and non-COVID related matters as well. Minnesota Board on Aging, MnDOT, DEED, Human Rights, and Administration, those are all critical partners. Human rights in particular, I've just gotten, as a result of COVID, an opportunity to work a little bit closer with Commissioner Lucero, who is the new Human Rights Commissioner in this new administration. She has convened a COVID response work group just looking at equity issues, looking at how different communities are being impacted. Unfortunately, COVID is not hitting everybody in the same way. In Minnesota, certain communities have very disproportionate incidence rates, very disproportionate death rates. And we know that's because not every community has the opportunity for healthy aging. And so not everybody has the ability to, socially distance or to stay at home safely. Their home might be a place where a lot of people live, a lot of family members, and those family members might not be able to stop work. They might be essential workers, or they might need the income in order to have their daily needs met. So we're really trying to work really closely with all of these agency partners. DEED, just to, again, kind of bring it back to some of the COVID response, we're trying to work with DEED and Dolly to have more age-friendly recognition of older adults as consumers. Some of the grocery stores had been implementing early morning shopping hours to recognize the fact that certain people who have heightened risk for COVID want to maybe access the store at a different time. We'd like to actually get some guidance out. We're in the process of drafting that to have that be available basically in every store, that customers who have that need are recognized. Next slide. Okay, there are a lot of gaps and opportunities across all of our programs. To become more age-friendly really does require a data-informed decision-making. I think that the Age-Friendly Council is doing that work, and I'm really appreciative of it. So just to call attention to a couple projects that we've been working on, really considering how the assessments work for home and community-based services. Are those creating artificial barriers to services? This is a broad research project that's happening over the course of about 2 years at DHS, really understanding why different people use different waivers or different services. Is that by choice? Is it a result of structural racism or structural barriers that we've created that are artificial barriers to services? Or does it reflect different communities' family approaches to aging and thinking about aging differently as different communities? Some people maybe don't necessarily want a loved one to go off and live in a facility somewhere. They might want to keep them really much closer to them. I'll be really interested to see how COVID changes the face of what we consider aging, or the types of services we offer. Are people going to want to live in institutions going forward? And can we restore confidence in those institutions? PCA and home care services, we are aware the data is very stark there and very distinct in terms of who's enrolled in that. And so, those are the kinds of research analyses that we're looking at to make more age-friendly informed policy choices. Next slide. So we have a lot of different reports. I know time is pretty short, so I won't go into the intense details on all of these. I'll just call attention to a couple things. The Moving Home Minnesota program is a really valuable one. That one is one that helps people move out of an institution back into a community setting when that's their desire to do so. It's been very successful over the years. It's gotten extended by Congress, I think 2 or 3 times. Was scheduled to expire again here at the end of May, and I think got extended again. So that's a really valuable one that the Age-Friendly Council could look at for continued work and expansion. And then I also want to call attention to the homelessness study. We're actually trying to draw more attention to this because we know that older adults who are homelessness are at very severe risk of COVID outcomes. In fact, I heard this morning that among people who are homeless and diagnosed with COVID, the hospitalization rate is 45%. So that's dramatically higher than a similarly situated person who has permanent shelter, who has housing. Outside of COVID, we know homelessness is really kind of an epidemic, and there are growing numbers of older adults who are showing up in the homelessness incidence study. I think the fastest growing population is over 65. What is influencing that? How can the Age-Friendly Council think about the root causes of that and the lack of housing, and how does that interact with our correction system and people who maybe have a problem getting access to housing or are not able to access our normal long-term care system, in the sense that they might be discriminated based on a prior felony or something in their background, some kind of trauma. So I just wanted to touch on a couple of those, but we can go to the next slide. We just threw this in. I mean, we really are trying to think about all of the different components of the age-friendly matrix in our work, and certainly consider what we can do differently for all of them. So I won't delve too much into this, but it's definitely front and center in the work that we're doing. Next slide. Okay, I just did want to draw attention to the DHS website that has all of our peacetime emergency authority and waivers. And, you know, we really have tried to incorporate age-friendly principles into these and consider what are the ways we can provide more flexibility, remote services, telemedicine, letting people stay in their homes, recognizing that it's hard to make it to a county for re-enrollment or for eligibility, recognizing that nursing homes and assisted living need additional funding to provide services when they have a COVID case. So, you know, this list I think is now, I want to say we're up to number 70 or maybe even 80 in terms of flexibilities and waivers that we've provided as a result of COVID. And my hope is that we can look at these as a council and maybe think about ones that should become permanent law. Most of these will expire if the governor's peacetime emergency ends, and they would require the legislature to make a permanent law change to continue them outside of that peacetime emergency. And some of these things are maybe things that will make us a more age-friendly state. Maybe it shouldn't be necessary for people to have to, you know, travel to a county office for renewal or for eligibility screening. And how do we change some of those things? Next slide.
Okay.
All right. Well, I tried to keep to 5 minutes. I might have gone over a little, but open to questions or comments. And thanks so much for letting us be part of today's presentation.
Yeah, thank you, Councilmember Pollock. We're going to move on to our last state agency to catch up some time here for our public testimony as well. So thank you so much. Our last agency was invited to participate, representing the Minnesota Department of Revenue, is Assistant Commissioner Robert Doty. Assistant Commissioner.
Hi, how are you doing? Can you hear me?
We can, thank you.
Okay, great. All right. My name is Robert Doty, and I am Assistant Commissioner at the Minnesota Department of Revenue. And we are not, at this time, a member of the council, but am so delighted to be able to give you a brief overview of some of the things that our agency is doing, and just to highlight ways that we can partner with the council. Next slide, please. So first of all, just a quick look at our mission, which is working together to fund Minnesota's future. And you can see our vision. I love our vision a lot. It's everyone reports, pays, and receives the right amount, no more, no less. And I hear that all the time. So I think it's a great sentiment for us. Next slide. Just taking a quick look at our customers. Who are our customers? 2.9 million individual income tax filers. We work with tax professionals, legislators, military, seniors, farmers. We work with people from various communities all across the state. We have over 800,000 property tax filers, and we work with property tax assessors in all 87 counties across the state. And we have 415,000 businesses that file and pay taxes. And that little note at the bottom, 160,000 businesses remit sales tax. Next slide, please. So a couple of areas that I want to highlight that I think are important for the council to kind of understand. First is our volunteer income tax assistance programs. And you can see we've got over 200 locations across the state that help people prepare their income taxes for free. And we'll come back to that in a little bit here. The other one is our senior citizen property tax deferral program. And in that program, taxpayers who are over 65 who meet income guidelines can defer their property taxes. And again, I'll come back and explain a little bit more on that in a minute. Next slide, please. Regarding our VITA program, last year, the VITA program prepared more than 71,000 federal income tax returns, 75,000 Minnesota tax returns, and 57,000 property tax returns. And that netted the state about $133 million, I should say both federal and state, in property tax returns. COVID-19 has caused us to, like all agencies, to kind of rethink how we provide our services. And starting today, we're starting to actually offer virtual VITA sites to customers. Next slide, please. So I think what we just wanted to show on this slide is the rate of participation in the property tax deferral program. And as you can see, the rate of participation is actually fairly low. And I'm going to talk about I see that as definitely an area that we would like to partner with the council on and work to figure out how we can increase those numbers. It's a great program, and there are clearly more seniors out there who could benefit from the program. We got to help get them involved and get the word out better to them. Next slide. So again, looking at opportunities, as I talked about. So for the senior deferral program, really a couple things that are important. One, as I mentioned, outreach. It is really important that we get the word out to seniors about the benefits of this program. Again, I showed you our participation rates are fairly low, and we know we can do a better job of getting those rates up. The other piece is maybe some policy changes around how the program itself is structured. And just to give you a sense of how the program really in general works is that for participants, they're relative to their property taxes, they would pay no more than 3% of their total household income. And then the state would actually pay the rest of their property taxes, and that would come in the form of a loan that would be repaid when the participant would either sell their home or leave the program. Participants need to be at least 65 years or older and have an income threshold of $60,000 or less. And they need to have owned or lived in their home for the last 15 years. So maybe part of what we can do as we start to do a better job of outreach is also looking at some of those requirements and changes to the policies related to the program to see if that can help. But working with the council, we think would be a good move for us to help do that. Next slide. And then just a quick sample of a couple of our partners. I mentioned earlier that we work very closely with all 87 counties in the state, and a lot of that is on property tax issues and the like. And then, as I heard earlier, the Council on Homelessness, we have been also working with that group as well. Our senior deferral program is something that we're pushing through that council as well. Again, anything that helps seniors stay in their homes and avoid homelessness, which is a component of the work of the council. Again, that's something that we feel strongly about and want to be a part of helping to avoid that. Next slide. So with that, that's my high overview. Hope I didn't take too much time. Appreciate the opportunity. And again, even though we're not a member of the council, whatever we can do to partner and like to be able to do that and to stay in contact with the work of the council. Really appreciate the opportunity this morning.
Thank you so much, Assistant Commissioner Doty. We appreciate you coming to the council meeting and doing a presentation on the Department of Revenue, and we look forward to working with the department in the future. And on a last note, thank you to all of the state agencies that took time to prepare presentations for us to help us understand a little bit about the impact that their agencies have on age-friendly Minnesota, on older Minnesotans and their families. And I am looking at Chair Pugh. I am so excited to be able to turn this back over to you. Just a note to all of the council members, don't give Rena your cell phone number. You will get an emergency text that says, could you help Chair until the chair comes back, which I'm happy to do, but I'm very happy to turn it back over to our chair, who is on mute.
Okay, thank you, Rajan. You did such a wonderful job. I really feel like you could take over the rest of the meeting, but I'll take on my responsibilities. This has been really exciting, and we have two exciting individuals to present testimony next, and we'll start with Tom Hyder from the Minnesota Gerontological Gerontological Society, who had a very successful conference. I think it's about almost a month ago, in which there were over 2,000 participants. And in that conference, they did a survey to collect some information that can be useful to our council. So, Tom, do you want to take it away now?
I'll be happy to. Thank you very much, Chairman Pugh. I hope everyone can hear me. The Minnesota Gerontological Society, we actually dedicated our entire conference to the age-friendly movement in Minnesota once we knew that the governor was going to form this age-friendly council. And I wanted people to see, I've got two objectives today. Number one, to let those that weren't involved in the program to see what took place in April. And then secondly, we did do some polling of the aging services professionals across the state. I want to share the information with this council on what they deem are the most important parts of the age-friendly movement. I want to shout out to many that are on this call who participated as experts in our program. You can see our keynote address was by Dana Bradley, who has worked with the World Health Organization and AARP from the very beginning. We had two panels. Adam Sulmala, who's on the call, Executive Director of Leadership Council on Aging, was our facilitator. I want to thank Chair Sherry Pugh for being on this particular panel. We focused with Northfield, Nan Just, and then we had an individual, Laverne Gilliam. Our second panel, thank you to Rajan Moon, also on this council, Will Phillips, who's on the call from AARP, and Patsy Bartley from SHIFT. And then finally, the closing comment was from Dan Pollock. Thank you, Assistant Commissioner Pollock, who did a brilliant job of bringing everyone up to date on what the Department of Human Services is doing. You can see the title of our council was Age-Friendly Minnesota, Age-Friendly Communities, and Age-Friendly Youth. The attendance we had, we actually immediately went virtual when the COVID crisis hit. We were fortunate to be able to offer this for free because of the support of our sponsors, and you can see we had over 1,500 people actually participated in the program. This is a view of the map of the United States, and you can see we had folks from all over. There was a concentration on the East Coast because our keynote speaker was from Baltimore, Maryland, but you can also see most of the individuals came from the Midwest. So here's the map of Minnesota and surrounding states. One of the things that MGS does is we try to provide quality educational programs to folks in greater Minnesota. And I think you can just see from this map that mission accomplished, that many of the individuals that participated in this conference were from greater Minnesota and some from surrounding states. Our target audience are the professionals that work in the field of aging. And so I wanted to show this slide so you could
Councilor Pugh, I just wanted to interject and let Tom know that we can't see his slides.
Yes, please do. I didn't know what to do.
Okay, can someone give me permission to be a presenter?
So Tom, if you just scroll your cursor to the bottom of the screen, you'll see on the far right, present now. Do you see the microphone hang up? Turn on captions, present now. You may just have.
I'm clicking that and I'm saying present.
And then you'll need to select the one on your screen, Tom. It could give you your desktop option on your screen. Click that and push share. As soon as you hit present now, choose desktop, check the screen.
Okay, the options I have are my entire screen, a window, or Chrome.
Just do the entire screen. And then on your screen, you see it says in the middle, you'll see your desktop there. Click that, a picture of it, and then click share. There you go.
Okay, apologies for folks. I thought I was sharing my screen. So anyway, I will run through. This was the program. These were the number of people that were attending the conference from all over the country. And here's where I was a map of Minnesota. And you can see that one of our goals is to provide education to individuals from across the state, especially in greater Minnesota. So you can see that many individuals from all across the state and the region were able to attend this conference, which took place on April 24th back in April. Our target audience are the professionals that work in the field of aging. So you can see from this graph that the majority, over 80% of the attendees were professionals that work in aging services. About 10% were professionals in healthcare. And then we had students, faculty, retirees, and volunteers. Just in terms of the council itself, I thought this was interesting that the vast majority of people thought that the presentations were excellent, very good, and good. So I believe the quality of the program was hit the target. And then as you can see from the keynote guests, the panel 1, panel 2, and Dan Pollock's call to action, again, very, very favorable evaluations in terms of people that attended the conference. Now, this next part is the part I really wanted to share. In our evaluation, and again, keep in mind, these are the professionals that work in the field of aging. We asked them to rank the 8 domains of age-friendly living in terms of what they felt were the highest priorities. And we hope that this work, this evaluation will inform the work of the council. You can see that the highest ranking was housing. I think that's a surprise. The next 2 were health services and transportation. Then social participation and communication and information ranked next, after respect, social inclusion. I think that's really important because what this council is doing is they are communicating and involving people from all across the state in the movement of age-friendly Minnesota. And you can see where all 3 of these, communication, social inclusion, respect, and social participation, ranked very, very high. And then it was rounded out by outdoor spaces and buildings and work and civic engagement. I thought it would be interesting for everyone on the council to see when we ranked, or when our participants ranked these 8 domains, how they were ranked. So I'm going to start from top to bottom. So you can see this was the housing. And again, almost 40% ranked housing as number 1. So number 1 is the most important. Number 8 is the least important. So you can see how housing was a very, very high priority for the aging services professionals across the state. Domain 2 is transportation. Again, you can see where in the top 3, very, very important how they rank transportation. Community and health services, again, 1, 2, 3, and 4, 5, very, very important in terms of how people rank the importance of community and health services in the age-friendly movement. There's respect and social inclusion, very even across the board. Social participation, again, right in the middle. Communication and information, again, very even across the board. And then outdoor spaces and buildings, you can see where the more human in communication and health transportation is ranked the highest, and outdoor spaces and buildings were toward the bottom. And then finally, work and civic engagement came in last, which was a little surprising to me, but you can see how those numbers came through. So we also asked which group of individuals are underrepresented or underserved in the age-friendly movement. Who's being overlooked? Who's being left out of the conversation? So again, this is by age and ethnicity. And you can see how in this particular poll, the young adult and college students were ranked being left out a little bit more than seniors. Well, the highest one was racial, ethnic, and cultural minority, and then specifically African American community and the Native American community. We also asked by geographic area, and I think this is really important, and I know that the council will keep this in mind as you are ranking your priorities, that the geographic area is important across the board, but especially you see the communities, suburban and greater metro areas, the rural areas, especially in the tribal areas. So you can infer by this that The metro area, in the participants' opinion, was being served at least to the highest degree, but these are the areas they want to make sure that the age-friendly movement and the Governor's Council on Age-Friendly Minnesota focuses the rural areas, tribal areas, and small communities. We also asked them about what type of living arrangements and personal health or disabilities were important and felt like it was being left out of the conversation. So again, you see that living in congregate facilities or living alone and housebound were the top two in terms of the individuals, the older individuals, that it's very important to include in the conversation about the age-friendly movement. Those with disabilities, hearing loss, vision impaired, those in poor health, and those with dementia and mental illness also made the top list, that it's very important to include them as this work goes forward. Then we had one last look at the types of agencies or businesses or rankings that were left out. And you can see at the very bottom, the low income and the poor were by far the highest in terms of who's being left out of the conversation, and then the homeless. Also some business and local officials, the agencies serving seniors, those that are in poor chronic health, those with low literacy, lack of transportation. So again, it's critically important to reach those that aren't typically involved or active in endeavors as the council is undertaking. Wanted to go into a little bit more depth here. I'm not going to read all of this, obviously, because these slides will be available for the council, but we also asked specifically what could be done in these areas that would help to involve these individuals and help inform the Governor's Council. So just as an example, let's take Domain 5, Respect and Social Inclusion, to be sure to involve seniors and to have seniors as contributors, to include language support, to also include those that collaborate with seniors like parish nurses, faith communities, community-based social services, and to recruit and use volunteers. Very, very important in trying to get the work out. Let's take Domain 7, Communication and Information, that it's critically important that accurate information be delivered in a format that's easy to understand and access, and help provide technology tools, whether that's the internet or a new device or a Zoom meeting or a Google meeting like this one, and training for individuals that don't typically use that type of virtual information to be sure that they're included in the conversation. And community and health services, again, to ensure that seniors are contacted on a regular basis and that their basic needs are being met. In general, finally, you can see that we need to be innovative and creative to reach and connect seniors, to make sure that the vulnerable are protected, and to advocate for those who cannot advocate for themselves. So finally, and this was really interesting, we asked participants to name their community and to rank its age-friendly services in all respondents. And so you can see actually where 18% thought that their particular community was very good in terms of its age-friendly response. About half, 43% good, but there were 31% fair and a small percentage poor. So I think it's good to keep this in mind. This is a public perception of the professionals that work across the state in aging services of how well they felt their communities were doing at the present time. And we just picked some of the more larger populated areas, Minneapolis, St. Paul, and Rochester. So you can see the numbers here in terms of how people felt that their communities were doing. And on the far right, these numbers represent all communities. So again, right in the middle, about 50% or so felt that their communities were doing a good job, but about 40%, 37 actually felt it was a fair job. So certainly we all know that we all have work to do to work on the community level in terms of making all of the places that we live age-friendly. So lastly, I'd just like to close by saying a couple of things. The Minnesota Gerontological Society is would love to be a partner, as we already are with the Governor's Council. We would like to offer the use of our webcast services, and we will be more than happy to do a monthly webcast once this council comes to some decisions and makes your priorities. Just as a quick example, as soon as the COVID crisis hit, we do monthly webinars, and we decided that we would be very nimble and only offer those types of educational programs that were really focused on what people needed at the time. Typically, we'd have about 400 and 450 people attend one of our webinars. As soon as the crisis hit, we've been averaging between 1,200 and 2,000 people for each webinar. We've done 4. We've done them on mindful presence. We've done them on the COVID crisis and those with disabilities. We just finished one on, we're going to be doing one on telecommunication and telehealth and working with the individuals that need mental health. And so again, we would like to offer our services in any way we can help this council to get the word out. And the last thing I'd like to say is our event is recorded and it's on our website. You can see the link there. It's about a 3.5-hour conference, and it's free for everyone to access with the recording and the handouts. So thank you very much for letting me present, and I hope MGS can be an active partner as we go forward.
Thank you, Tom. That was really informative and gave me a lot of thoughts about things that we certainly can use and to help us raise more questions. And given what we've heard from state agencies, this is all really folding together nicely. I think we'll have a wealth of information. I hope we have enough time to get it all together, but we'll work hard and diligently. And we definitely want to utilize your services of your organization in getting the word out. Okay, next on our public testimony is Cheryl Hennen, who is the director of the Office of the Ombudsman and Long-Term Care. And I have to tell this story because when I first got on the Board on Aging, I didn't really know what the Ombudsman's office did. And I got this invitation to come to a volunteer recognition luncheon. And I went. It was in this community building in St. Paul near Marion Park. And it was just so delightful. This group of women, I think there might have been a couple of men, but it was age, very diverse. It was racially diverse. And these are people who, in the spirit of Minnesota volunteerism, were really committed to working with people in skilled nursing homes and helping the Office of the Ombudsman carry forward. So it's always had a special place in my heart. And I know that during COVID-19, they have really had an emotional roller coaster. So we look forward, Cheryl, to hearing your presentation on what's going on with the Ombudsman's office. Cheryl, you can unmute. Cheryl, you need to unmute.
Can you hear me?
Yes.
Thank you very much, Chair Pugh, for that wonderful introduction. I am honored. Thank you, council members, for inviting me to provide public testimony today. I am Cheryl Hennen, the State Long-Term Care Ombudsman, and perfect segue to what other speakers have mentioned, as well as Mr. Hyder. I want to start by start with the end in mind. So for me, the end in mind includes saying to all of you that we need to be active, proactive in engaging seniors in every community. If that means actually going to nursing homes, assisted livings, the veterans homes, I feel we need to really plan forward how we engage our seniors in community conversation, because long-term care facilities are part of a community. They're an active living part of every community. We also need to provide accurate information, and I'll be touching on a few topics that have come to light during the crisis. And also, I will say that we need to ensure, and I am your partner on this, and I look forward to being engaged with the council in future work to ensure that our policies, our procedures, all of our communications reflect ageism. Everyone hearing my voice is aging. No one is, if we get one more day on this wonderful earth, we are all aging. So when we look forward to what we will plan ahead, that includes all of us, as well as some wonderful people that currently reside in our long-term care settings. So I have a few slides that give a basic overview of what is the Long-Term Care Ombudsman Program. Next slide. And I typically do not put a lot of words on my slides, but today I am, because I will not read everything to you, but please go back and look over my information for more detail. Under the Federal Older Americans Act, every state is required to have an ombudsman program that addresses claims and advocates for improvements in long-term care systems and services. We are a program of the Minnesota Board on Aging. Please, no disrespect intended. We are not ombudsman of the Department of Human Services, but my office is in the building of the Department of Human Services, and I appreciate the good working relationship that we have. We are all designated as advocates for the residents of nursing homes, board and care homes, assisted facilities, and similar adult care facilities. We work bedside. We work directly with people to resolve problems of individuals and to bring changes at the local, state, and national level to improve care. I will say many people receive good care in long-term care settings, but others are neglected, suffer from incidents of abuse and exploitation. You may ask, who's to create the Ombudsman program? Well, it was Dr. Arthur Fleming, a member of the Nixon administration. Why? It was due to poor care provided in nursing homes, which prompted more involvement, more voices heard at the communities, and action was put into place. We currently have within our Ombudsman program 27 staff members as well as volunteers. Next slide. This slide will for you what the Ombudsman program does. And this is taken from the Older Americans Act. I will not read each bullet to you. We must also comply with strict confidentiality provisions, specific conflict of interest provisions, pursue administrative, legal, and other remedies on behalf of residents. And the program is protected from willful interference. I will add that work to provide technical support for the development of resident and family councils, which is engaging residents and families within long-term care communities. Next slide. So today I was asked to talk about healthcare directives, which unfortunately in the pandemic, we know that I believe the crisis presents challenges in terms of what a healthcare directive is really used for. And what I mean by that is, in one way, people do not have access to their loved ones due to visitor restrictions. But briefly, a healthcare directive is the primary legal tool for any healthcare decision-making when someone cannot speak for themselves. And it appoints an agent, provides written statement concerning what the individual wants for future healthcare. So is it required that everyone have a healthcare directive? No, but nursing homes have additional obligations to document in the part of the resident's medical record whether or not the individual has executed an advance directive. This is true for both new people coming into a nursing home or a long-term care, someone who's been living in the long-term care facility for a while. There's a lot of information about healthcare directive, but I wanted you to be aware of the Patient Self-Determination Act, which is federal law that requires, at the time of admission, you'll see the bullets, a written summary, and many of you may have experienced why you are getting this information is part of the Patient Self-Determination Act. What's not on this slide is what's called the POL. The POL stands for Physician Order for Life-Sustaining Treatment. It's another advanced planning tool, and the purpose of the POLs is for people with one or more serious advanced illnesses to be able to have a conversation about the type of treatment that they prefer. And this is usually for people who have a very serious terminal illness. The POLS is a medical order. It means that wishes will be known and should be followed during a medical emergency. The POLS is a form. It's used and recognized by hospital systems, long-term care facilities, medical professionals, and emergency medical services throughout Minnesota. So what we have been hearing from many families currently during the crisis is because they cannot be next to their individual, they may have a healthcare directive in place, but most importantly, they want to be available should their loved one's health take a very different turn. Next slide, please. The planning ahead. We need to all understand that decision-making is much easier if planned for in advance when the person is competent, when the person can still make their own choices. Unfortunately, most people do not get much time to make this decision because the decision to move or the decision for treatment is happening at a very emergent time. Expressing preferences for end-of-life care in advance directives helps people and their families deal with questions. But as I said earlier, this may be something that is done during an emergency, and right now it may be difficult conversations. Next slide, please. This slide, this is information when I was putting together my slides. This is as of May 14th, so obviously these numbers have changed. But what I focus on is look at how residents of long-term care facilities are affected. Residents of long-term care facilities account for less than 1% of Minnesota's population, 13% of Minnesota's COVID-19 cases, and 81% of COVID-19 deaths. I want to point out the U.S. Senate Aging Committee held a hearing on caring for seniors amid the COVID-19 crisis. Prior to the hearing, Ranking Member Bob Casey, who is a Democrat in Pennsylvania, and Senator Sheldon Whitehouse, a Democrat in Rhode Island, introduced the Nursing Home COVID-19 Protection and Prevention Act, which is Senate 3768. This legislation seeks to help states implement strategies to reduce the spread of COVID-19 in congregate settings. So there are many good pieces of support in this legislation. But I lifted a quote from Senator Casey's statement during testimony, and I enter it here on the slide because I think about the work of the Age-Friendly Council. You may also agree this is how you might look at your purpose and objectives. For the generation that worked in our factories, fought our wars, taught our children, built the middle class, built the nation that we have, and gave each of us life and love, we have to do more for our seniors. We cannot stop working. We cannot stop legislating. We cannot stop appropriating dollars to help our seniors. Our country is in the midst of the greatest public health crisis. Many, many seniors in hospital ICUs and long-term care settings have died alone and scared with no access to family members or loved ones. Many more are isolated in their homes, afraid to leave. And I'm not wanting to put a cloud over this meeting, but the Ombudsman's office, Sherry's statement, We are on an emotional roller coaster every single day, walking at the side. Although we are virtual, we are in contact with many residents and families, and it's a very concerning time. Next slide, please. Healthcare directives in the midst of a crisis. Without reading every word here, I want to point out common misconceptions, why people enter into doing a healthcare directive, afraid they will lose control over decision making once they name a healthcare proxy or a healthcare power of attorney. In reality, a person continues to make independent decisions until the point that they are unable to speak for themselves. We must always ensure that what we are doing honors the wishes and the voice of residents. And some people fear the finality of filling out an advance directive. Especially now during the pandemic, some people are actually adding COVID-19 addendums to their current healthcare directives if they become sick with the virus, and then understand that that can be deleted after a vaccine becomes available. And we're all hoping and praying that a vaccine will become available sooner than later. Next slide, please. So as I started my public testimony in the beginning, we must always be aware, consider the effects of ageism. I talk about this frequently in my public presentations. Acknowledge that ageism is oppressive and humiliating and can become a self-fulfilling prophecy, and oftentimes people may not even realize what they are doing. They are actually contributing to it. We also need to understand that ageism can enter into when healthcare decisions are being made or resources. There's a shortage of resources. We must work against applying any age or disability criteria to the distribution of healthcare resources. Next slide, please. What was earlier in terms of legislation, I'm sorry I was not able to be on the entire call, but I do want to point out that prior to COVID-19, people in long-term care settings were visited by families and friends. And now, as I said earlier, due to visitor restrictions, such watchful eyes are not entering facilities. Our office, the long-term care ombudsman are not entering, protection agencies are not entering, licensing agencies are not operating sufficiently to ensure resident safety. Proposed legislation, Senate File 4603 and House File 4693, provides immunity from criminal, civil, or administrative liability to healthcare providers acting in good faith. This immunity is provided to a broad array of healthcare services in Minnesota, not only long-term care settings. However, I have with this legislation. Very similar proposed legislation is active around the country to grant immunity to nursing home owners and employees. The needs of residents in long-term care facilities is varied and significant, and the prevalence of physical and cognitive impairments places residents at a much greater risk of abuse, neglect, and poor care. As a state and as a country, we have always afforded people access to system because we respect how important it is to people, to residents, their health and their well-being. COVID-19 crisis is certainly not the time to disallow judicial recourse. We need to consider seriously the effects of any of this type of legislation moving forward. Final slide. Thank you for this time to speak with you today and look forward to any more work with the council in the future. Thank you.
I can't get there. Thank you, Cheryl. And thank you to everyone. This is the end of our meeting, but I do want to just give a few notes. I don't know what was said when I was in I don't know, cyberland. But our next meeting is June 10th, and that will be a working session where we'll be taking all of this information and merging it with the recommendation works that the different committees have been working on over the last 2 months. And then on June 20, I'm going to get the date wrong now, June 24th, I think it is, we'll have our regular scheduled meeting. There's the schedule there. Yeah, June 24th will be where we'll finalize our recommendations and present to each other those recommendations. We'll also be having testimony from the Diverse Elders Coalition and maybe someone else, we never know who, but we'll be continuing to work. Our plan is that by July 22nd, we would be in a position to have a final report that we would seek public testimony and seek any other inputs before submitting to the governor. Please remember that the work that we're doing at this stage is really setting in place for Minnesota to make its application to the national network of age-friendly communities, and that there will still be ongoing work over the next 3 to 4 years in doing an assessment and plans. But I say this to mean that also we would greatly appreciate any input that any of you have or ideas. And if you contact our staff, we'll certainly listen and see if there's opportunities for things to be presented to the council. So I think on that note, Rejan, again, thank you for taking over in my absence. It's amazing. I had a laptop, an iPad, and a phone and couldn't get in. That's really, I thought I had all the backups needed, but we want to move forward. The information today was outstanding. It showed opportunities for partnerships. It also identified how COVID-19 has identified and highlighted some of the things that we can do. And some of those things maybe are things that need to be permanently put in place. So there's great learnings from COVID-19. We started out with framing and we ended with Cheryl talking about ageism. And so we know how important we have to turn the dialogue around so that people are understanding and framing the conversation for the future. There is hope in the future, and we will get there. Thank you all very much. Rita, do we have anything else to say?
Thank you, Madam Chair. No, nothing else.
Okay, thank you all for coming and joining us today. It was great to have so many people. I was kind of reading the list. So all be safe, wash your hands, wear gloves and a mask. Okay, take care. Bye-bye.